Central Dispatch to Barnesville Ambulance. Respond to an MVA rollover 5 miles north of Barnesville, where a male has been ejected from the vehicle. We're getting reports from bystanders on scene that the patient's leg has been amputated. What I just said to you was an actual call that our ambulance service responded to, and the patient needed immediate IV access to treat his signs and symptoms. I feel it's important that everybody realize some of the treatments and procedures that can be performed in the back of an ambulance. That way, if you ever are transported by ambulance to the hospital, what I show you today may be performed on you, and you can recognize it. I've been a paramedic for 3 years now, and starting IVs is just what I do to treat my patients. It's part of what I do. Today I'm going to demonstrate how to start an IV. Along with that, I'm also going to take and discuss some of the different details of the IV procedures being performed. First, I'm going to take and explain to you what is an IV. Second, I'm going to go over the supplies needed to start the IV. And third, I'm going to have a member from my audience come forward to volunteer to have the IV process demonstrated on them. So first, what is an IV? IV is an abbreviation for intravenous. It's a small catheter that's inserted into the blood vessel by puncturing the skin or the outside wall of the blood vessel with a needle. There's many different types of size IV catheters. 24 gauge, which is the smallest, all the way to 14 gauge, which is the largest. The IV catheter that we're going to be using today is a 20 gauge. This is a mid-range IV catheter. What are IVs used for? IVs are a great way to administer medications. This can be anything, anywhere from pain medication all the way to cardiac meds. IVs are also great for fluid resuscitation. When we have major trauma patients that are bleeding out, we can administer fluids to try and help the patient's blood pressure sustain an adequate level to get them to the hospital. Starting an IV is an advanced life support procedure. Most often than not, in the pre-hospital setting, it's performed by a paramedic. 94%, according to the Minnesota Ambulance Reporting System, 94% of the IV or the ALS calls performed by Barnesville Ambulance last year involved starting an IV. Now that we know what an IV is, I'd like to go over some of the supplies needed to start the IV. According to Brady's Volume 1 edition of Paramedic Care, the following supplies I'm going to show you are necessary for starting an IV. First, you're going to need the appropriate size IV catheter. Today we're going to be using a 20 gauge. Next, you're going to need to have a constricting band. This goes around the patient's arm to allow the blood vessels to pop up closer to the skin. You're also going to need to have the proper IV fluid and tubing. Normal saline is the most common fluids used in the pre-hospital setting. After that, we're going to need to have alcohol preps or iodine wipes. This is to help take and sterilize the IV site before starting the procedure to reduce the spread of infection. And last, we're going to need Veniguard or tape to help take and secure the IV site once we've gained access. Now that we know the different supplies needed to start an IV, I'm going to have a member from my audience come forward so I can demonstrate the procedure. Okay, most important thing, we want to make sure we're gloved up. This is body substance isolation to make sure we reduce the risk of infection to the patient and to ourselves. We want to make sure that we look for the proper IV access. Looking at her hand, that this is a great vein right here to gain access. Next, we're going to take and apply the constricting band to get that vein to pop up closer. And then now, we need to take and prep the site with an alcohol prep. Tubing ready. Okay, once the site is prepped and we know which vein we're going for, Just going to grab the patient's hand, pull the skin nice and taut, insert the IV. We got a good flash right now. That means that we've entered the vein with the blood coming up the catheter like that. Now we just need to try and advance it, which it's doing nicely. Once that's done, we just take and undo the constricting band and take and occlude it by pushing down on the vein so blood doesn't come out the catheter. Retract the needle. And we're going to take and hook up our tubing. And we're just going to see if this flows properly, which it is. So now that we got access and it's working properly, just going to take and secure the site with our VenaGuard. There we go. And that's how you start an IV. Today I've demonstrated to you how to start an IV, and I've also discussed some of the different details that are vital to performing the procedure. I've explained to you what an IV is. I've also gone over the supplies needed to start an IV, and I've demonstrated the IV procedure on a member of my audience. Please remember, if you are ever transported by ambulance to the hospital and a paramedic's trying to start an IV on you, remember, it could be to save your life. Thank you.